So today we're going to be doing a number and working together to make Stax look a little younger.
Do not wait, because you all deserve to look good and healthy.
What's up, baby? What's up, baby? Guys, today we're gonna do something a little bit different, guys. You know, I've been wanting to switch up the content, and I'm working with a good friend of mine, Dr. G, the different Dr. G, but another awesome doctor. And we got to talking, and you know, Stax is 37 years young, and I'm only looking older. You know, it's very important that you take care of not only your aesthetics, right, your health and the inside, but also you look good, you feel good. I got with the doc and we started talking on what I could do to look a little bit younger. I said, I want to look like the young Rock. I didn't say that at all. But I did say that I was tired of a bunch of, you know, wrinkles I had here and some wrinkles. So today we're going to be doing a number and working together to make Stax look a little younger. Last call.
I have another Rolex, I just don't wear it. Just like, you know, when my patients.
I know, but that one's so cool.
The bust down.
Yeah.
We haven't done anything.
Lovely.
It is a virgin face.
Woo!
Yes.
Perfect. And honestly, for working out so much, you haven't lost that much volume. Sometimes you'll see all the bodybuilders, I mean, you know, the bodybuilders, and you see them on camera or when they have their spray on stage, and they have some nice, really crazy flat malar creases where their bodies look amazing, but their faces are kind of divoted. So you've maintained some good volume in your face. So you haven't lost everything, which is great.
It's positive right there.
Yeah. So remember that your goal is to, you're either enhancing or you're altering. And you have to decide before you ever touch a patient which one you're doing, right? You can't just guess. So for males patients, you want to make sure that there's a lovely transition from their frontalis down through their temple and then down to accent their jaw. Good zygoma and zygomatic arch, good jawline. Some of that could also be like you cheat and put your little your lower face hair. Do you happen to have a white pencil? Yeah. So you can see the parameters. Here's the upper portion of his zygomatic arch. Here's the lower portion of his zygomatic arch. And I think for him, a combination of a tiny bit of HA for some detail work, maybe a little bit of define to help this nice wrinkle coming, and then some global Sculptra. I'm not going to put any here. Do you see his good volume? He already has. Smile for me. Smile. See how he has nice volume right there? And then relax. And then he's missing a little bit of a volume deficit here. So in this triangulated area, I will 100% put a little bit of contour. And we can even do nasal labial fold. And his lower face volume actually looks really good. You definitely probably have a hypertrophic mass. Do you grind your teeth a little? Or like you're just always in tense mode, right? Yeah.
Definitely that.
I can see it. So we're going to help the rest of his face maintain and not deflate while his muscles holding the volume for his see it? Perfect. Any questions? It's nice to have a change in a gentleman too, so you can see that like the world is your oyster. All you have to do is enhance or alter, and for him, we're enhancing. He already looks good. We're just gonna make him look a little better.
That's it.
Thank you.
Gravity's not ever our friend. Not today, not tomorrow, not ever. And so I'm gonna start lateral, and I'm gonna help build his periosteum.
You're using contour for the periosteum?
I am, and I'm gonna use contour because he almost is nice and flat. So I want to keep exactly what he has, just accentuate it a little bit. So you go straight in, you feel a little pinch. Perfect. Or less. That looks great. How is it that everybody's staring at you? Do you feel like you're on stage?
Yeah, he's always on the stage. You're following him.
On Instagram, you're used to it?
Yes.
Cool.
YouTube, Instagram.
There you go. And so now I'm going to trace myself going back. And I want to maintain the integrity of his anatomy and just give a little highlight to his zygomatic arch to help him out.
Not that it doesn't look good right now.
It's age 7 years is what I mean, right?
So you don't start aging till you're 30?
In theory. But you do start losing collagen when you're 20. So, you know, all the things.
I know.
I've
been training for 21 years.
There you go.
So how...
So you were building muscle while you were losing collagen starting at the age of 20. You were starting earlier, but your collagen was falling off about then. You're gonna get a fat face before you get a fabulous face, especially if I'm doing 3 vials in one hit, right? That's a lot of fluid and a lot of water.
I think the eyes really have more.
More volume loss?
Yeah.
So you can do, I mean, he honestly has good volume. He just needs neurotoxin here. What's this line coming right here? Anybody know what that is?
Sleep line?
Correct. That's him and all his fault. You're not going to fix this today, not tomorrow, not
No,
ever.
we can fix it through the other techniques.
What is it?
No, you honestly can't. You can make it look a little bit
Yeah,
better,
better, yeah.
but if the human head weighs way too many pounds, and how many hours of sleep do you get a night?
Don't lie.
5.
Okay, 5. Still, 5 a night, like that's gonna be, he's doing this all night, every night, whether you like him or not. There's no amount of filler or anything else that can help him. So you can definitely make it look better. But you don't promise anything because this is his fault.
Oh,
What do you sleep on my back or what?
no, it's not super bad. You're good.
Sleep on my, can't have a pillow?
Sit up for us to see a second. See how now that lower face can compete with that zygomatic arch. He still has great definition in the front. And remember, all of this right now, he's going to look a little chipmunky. That's just our water. It'll go down and it'll build some collagen for him, so he will have a better transition. Fabulous. Okay, other side.
There's no gym after this?
No.
No?
No. You're done with the gym for today.
It's already gone way down. You did great. You made it. Now you really have to eat some lunch so you don't pass out.
What about his
Brown get mad?
Yeah.
I'm not like mad, but like I look mad.
But I don't know that you
So
want to
I'm
take that
always
off
staring
because
at
it
people
kind
like-
of like goes with his persona. You know what I mean?
Yeah.
No.
I'm just joking. But I'm saying sometimes.
I was like, yeah, but I don't want that person.
Right?
I find myself
Do
with
you
my
want me to
pastor.
share it?
I'm staring at him at church like,
Like that.
he's like, what did I do? Yeah.
Well, and something you also want to remember the occupation of your patient population. The worst that you can imagine is someone who's trying to have some emphasis with zero expression in their face. So those people, I will realize that I'm gonna have to let you wrinkle a little bit because you need to be effective. So
Yeah.
like your volume and your sculpture is gonna be amazing, but I need to let you move. Try to be mad. Try to tell me something. That looks so silly.
Can't even lift
You know?
your, yeah, nothing happens in your face. Yeah.
No, you can't make people cry when you look like this the whole time. You know what I mean? So for their job, I can
will.
too.
Yes.
Perfect. But for you, we can soften it for
I just
sure.
forgot, make me look nice, please.
Yes,
I do like it better.
Easy enough.
I've worked it.
you did it.
Hey,
Thank you.
You're welcome.
Joey, you did it.
An OR there.
Oh, very
Yeah.
good.
Thank you.
You're welcome.
I'm excited to see the results.
I know.
Is it swollen?
A little bit.
The 555.
Yeah, 5 minutes for 5 days.
Get you an ice pack first.
You see how these were right here when you had it in? They filled it in.
Yeah.
You sleep to mine.
So this is gonna freeze my forehead?
Yep. So when you go like this,
It's
You
just,
have no
it's just
lines.
my eyebrows, right?
then your eyebrows. So then you know you're mad. You're like, butt bitch, butt bitch.
Dude, what do you mean? It's probably a bad thing. They're gonna stop playing, Joey.
Yeah.
I ain't playing. I'm so mad.
You're so happy right now.
Because influencing wasn't like super
It
cool
wasn't.
until
We
like
were called
2018.
Instagram models in the beginning.
Yeah.
I was an IG model. And then we went from IG models to now influencers. It's STAX.
I found you.
Wait,
I also got my own
compete?
supplements. I also got my own clothing line. My
That's awesome.
Cool.
solar business. I have a GC general contracting company, massage clinic over at Babcock.
Dang, you diversify. Good for you.
Yeah,
That's
I had
awesome.
to, you know what I mean? I come from a little bit of a bad background, so I had no choice but to be an entrepreneur.
Good call, man.
Gotta stand up then.
Watching.
You have a team of handlers.
Yeah, I know.
Hello, this is Dr. G, and we just did a procedure. We used the natural looking appearance module. We used Sculptra to start the neocollagenesis on the face. He already has a sculpted face. We just need to give little touch of restyling contour to make the cheek line more prominent. He already has a very good jawline. We just put some more Sculptra so that the wrinkles around some of the area, when the neocollagenesis start to happen, they will all gone. Also, we use Disport for the angry looking lines he has. He will not be looking that angry anymore.
I can't move right now.
Yes.
4 hours, no
How do you
facial.
feel?
I feel good, yeah. I mean, no pain. The procedure went great. Obviously I knew what the doctor was talking about and the size needles that she was saying. And
Oh my
I'm
God.
and I'm thinking in my head, like, what? That's a
like
25? But it wasn't bad at all. I mean, obviously with the stuff that you put in help numbing, and once it goes in, it's a slight pinch, pinch. Honestly, all of the Discord,
Discord, yes.
the Botox on the forehead, I didn't feel that at all.
Yes.
I didn't feel that at all because it was such a small
needle,
Yeah.
and plus it's gonna disperse. So for the first 4 hours, you are not going to move your head down, up. You can't go to the bed. You can, if you are watching your phone, don't look at the phone like this.
Yeah, look it straight.
Look at like that straight, because
I want basically a straight face.
straight face. You can move like this, okay, but nothing other than movement.
And then how is the massaging again? 5 times a day.
That is not for the forehead.
Okay, just for
that is only the area where we injected Sculptra. Okay, and that will just help to stimulate and disperse the Sculptra everywhere. Okay, so your neocollagenesis happens all over the face, and in about 6 to 8 weeks, you started feeling that your skin started to tighten more, and you will have more sculpted appearance.
I'm
I
excited.
can't wait to see the
I'm
results.
about to be a 27-year-old again.
Oh, definitely.
Let's go.
Yes,
I'm
yes.
excited.
You're only 7-year-old, remember?
Oh, 7,
The
yeah, 7
real
years
aging
old.
start at the age of 30, though the loss of collagen start at the age of 20, 1% every year, and the loss of volume start at the age of 30, which is 1.7 cc every year.
Now you're getting super technical. Right? You lost me. But I believe him. I believe him. The man knows what he's doing for sure.
Okay. Thank you, Joey.
so much.
And I can't wait for the results to happen.
Yeah, I can't wait already for that next treatment, man. I think it's
You're gonna
not-
hook up to this now.
And this is like maintenance, right? It's
Yes.
not like a one-time thing.
No, it's not a one-time thing.
You definitely need to just
Maintenance.
Yeah, exactly. Just
But
like you
maintenance
your
won't
house and
be
you
that
call it.
long after a certain time,
Of
then
course.
it will decrease.
Of course, it's like right now you have to start coming every 3 months or so,
Yes.
and then after 3 months or so, you come less. You come less.
It's depending upon how the results are coming along.
Of course.
Okay?
And you know me, I'm a little bit different than everybody else because I
we all are different.
strong face
Strong face
muscles.
muscles, yes.
And I'm really excited about getting rid of these wrinkles. We went on the
Oh,
podcast.
yes. So you will
I was
see in 2
ashamed.
weeks, even less than 2 weeks, you will start seeing the results because the Disport it started to act a little early.
Mm-hmm.
So in 3 to 4 days, you will see that you will not be able to lift your muscles a little bit less,
Mm-hmm.
and then the final effect will come in 2 weeks.
But the beautiful thing is my eyebrows still work. All my real facial features work, but you don't have the wrinkle of the forehead no more.
Yes.
You lift your eyebrows, but the wrinkle will not be
Wrinkles
there.
will not be there.
Okay, yeah, I'm excited.
And I placed an extra one on this line more so that it will reduce.
Right.
And then we can do is that we can put a little bit of hyaluronic acid on these fillers in that, which is because it's static lines which you have formed by doing this over a long period of a time.
Of course.
Okay. And the other wrinkles are dynamic, which is formed because of the facial expression.
Of course.
Okay.
So basically, in time, the wrinkles will start to subside.
Subside,
Come
yeah.
come more out. They'll still be there.
Yes.
Because I waited so long.
Yes, but we can treat that too.
Of course.
Yes.
Yeah. So
There's
don't
a
wait too
treatment
long.
option for-
Do not wait.
Yes, do not wait because you all deserve to look good and healthy.
I'm excited.
Thank you.
Fun man. All right, guys. Got my meal in my bag right now. But we're here at Prime Vitality. Been about 16 days since I got the procedure done, and it's really starting to show on my cheeks a lot, and I just kind of want to see what Doc has to say more about it. So let's go in here and talk and see what he's got to. Now I'm doing a surprise attack, so I don't know if he's got time for me, but we'll see.
Go like
What's
this.
up, Doc?
Look up.
Look great.
Yeah, I've actually had a couple compliments.
You had a very deep wrinkles line
Oh,
there,
bad.
but now that's been gone.
Yeah.
You see the
And I shaved for y'all.
Yes, so
I just got my
so
beard
now
shaved.
your Sculptra has lifted your skin up because it's a collagen stimulator and it will keep doing that for next 6 to 9 months.
Okay.
Okay, and this funding has given you you just need that like it is a perfect. You look perfect now.
Still see a little bit, like you said, to keep it kind of natural.
Keep
but-
it kind of natural. We didn't want to go overboard on that because then it will become, and the wrinkles then it will become frozen, completely frozen. You don't want to have it frozen. Males, I don't like. Sometimes females, when they come and they say, oh, we don't want anything, you know.
I just got a big old head. So, look, you know, yeah.
It's because you're so smart.
Of course.
That's great.
Yeah, I definitely do.
Hello, and today we have a follow-up on Joy's talks. So how was your experience, Joy?
It's good. I mean, obviously we're 2 weeks now, and it's pretty funny. I told Doc before we even, like 7 days ago at like a weekend, somebody's like, man, you look different. You did something. Did you get a new haircut or did you get something? What's going on here? And I'm like, no, I actually got some stuff done to my. Of course, he knows all the technical stuff.
Yes.
He knows all the stuff. But me, I just say, oh, I got some stuff done to my face. I got some stuff done to my face, and I knew he did some injections in my cheeks, and I noticed it, you know, in 4 or 5 days. I could just see the pores in my cheeks kind of not so deep, kind of feel. They almost like my skin. I don't want to say stretches, but it like heals. It fills.
Tightens a little bit.
Yeah, it feels.
The sagginess will continue. And it
I just felt like
continues.
it filled. I looked at my face, the skin looked better, the pores looked better. I've been taking care of my face a lot more, moisturizing my face. So you gave me the moisturizer.
Yes.
So, and I didn't realize how important it was until now I see the difference in actually getting the procedure done.
Yes.
And obviously, I'm going to keep up with it.
Yeah.
I gotta
Because
keep
the
up.
most important thing is that people in general think that the man's aesthetic or beauty or health and wellness is more towards women, but no, everybody deserve to look their best, and our approach when it comes to the men's and women's are very different.
I don't know what type of man wants to be looking old, you know what I mean?
Our main goal is to educate
Just
the
call
people.
and ask. Call
Yes,
and ask.
yes.
This guy told me he has over 100 different procedures and things he offers for men and women. Probably not all for men,
Yes.
probably not all for women, but 100 different procedures he does here in this office, local in San Antonio, and it's insane. And I only got a few of them, right?
Yes.
I only got a few. Okay, well, let's hope I don't have to get too many, but I am excited about my next. It is maintenance on your body, so just like you get your nails done, just like you get your toes done, the best thing about this, you don't have to get it every 2 weeks. This procedure lasts 3-6 months, just depending. Everybody's different, but I haven't been too active, so I'm ready to see what it's like me getting back in the gym and see.
You look great. Like, you know, I don't know, when you get in the gym, you're probably gonna look.
Yeah, well, hey, I'm hoping to stand out looking like a 25-year-old again.
You look 25 already.
Thank you, Doc.
You're
Awesome.
welcome. Thank you.
Awesome.
Thank you.
You guys need to come check out Doc over here at Prime Vitality. He's the best doctor here in San
Thank
Antonio.
you.
Tested hand down. All right, this guy's been a doctor not once, but twice. All right, that says something. So you want to get some professional work done, you seek the professionals. Don't think that Stax is going to let this moneymaker be touched by somebody who's not a professional. Let's go.